We are a community-based nonprofit organization that's been doing a lot of work throughout New Jersey, bringing awareness to not just addiction, but also the epidemic that's sweeping our nation and our state, and the overdose rates and heroin use in New Jersey is staggering. And so it's become our mission to come out to communities throughout New Jersey, because everybody's impacted, and really bring some information and bring some speakers and have a dialogue, get an understanding from you, what you're experiencing here in West Milford, and really be able to share with you what we're seeing around the state, and in particular, be able to share some strategies and some things that are working, that are helping to combat this epidemic. But also, I really want to leave tonight with you feeling empowered, that there really are things you can do right here in your community and across the state, feeling hopeful because recovery happens and it works, and we have people here this evening that are living proof of that. So I'll just get started. This is a very brief version of a drug trends presentation that we do. Again, my organization has been working more and more in the county of Passaic. We've partnered with the County Alcohol and Drug Coordinator. We're partnering with United Passaic, the UP Coalition. So, and now we're here, and thanks to CASA and Rebecca, sorry. I'm hoping that we'll be here more often to partner with you. So, I just told you who we are. We're a community-based organization that really works collaboratively with communities to empower you to do the work that you need to do right here. These are some of our programs. We were successful in opening the first recovery high school in the state of New Jersey. I mention that because it's a great resource for you, even though it's located in Union County. I've met with superintendents and principals across the state. The furthest north I've been so far is Butler. So, I'm open to speaking with any school administrator or personnel that might be interested in figuring out how to bring this resource to your community as well. But basically it is what it sounds like. It's a school that's designed to work specifically with kids who are coming home after treatment, who need, recovery supports in their community, but that they can also continue with their education and not lose that academic time and not miss out on the goals that they've set for themselves and that you've set for them as their family. So my role tonight, I'm going to try to be quick and have the bulk of the conversation take place with our other two guest speakers, is really to bring attention to some very staggering statistics. And they are staggering. And as voting members of this community, I think the best thing you can do is once you see these numbers, you need to get actively involved in your local councils and really try to set community norms and ordinances and change the face of your community from a legislative perspective so that you're setting up the framework in your community that can reduce alcohol and drug abuse in West Milford. But every 4 minutes, someone dies of alcohol or other drugs in America, and that's equivalent to 350 people dying in a plane crash every day. And there are approximately 22 million Americans who have an addiction, and that's more than New York and Florida combined, their entire population. Over 90% of people who have an addiction started using drugs as teenagers, which is why programs like this and the organization CASA is so essential, because it starts young. And if you really want to do prevention work, you need to start before they start. So you need to really work with kids before they're in high school. And unfortunately, about 8.3 million children also live in a home where at least one of their parents also might need treatment for addiction. So of the nearly, one slide says 22, this one says 21 million people who have a substance use disorder, only about 1/10 of them receive treatment. And that's, 1.5 times the number of people who have cancer. And I keep this slide up here for a minute because I don't think that we should sit back as a community and as a country and ignore the fact that addiction is a disease, and that people who have this disease should have access to quality treatment and care. And when they don't, ultimately it can lead to their death. So some numbers for New Jersey. These are, also staggering. In New Jersey, about 161,000 individuals aged 12 through 20, which is 15.4% of all individuals in this age group, reported binge alcohol use within the prior month of being surveyed. So this percentage decreased a little over the past few years, but not enough, and I bring it up because alcohol is still oftentimes the first drug that our kids experiment with. So while we focus on heroin and why we're concerned about the number of young people who are dying from drug overdoses, we can't forget that we have to continue to keep alcohol in our discussion. We have to continue to stay focused on trying to reduce underage drinking, and we have to try to delay that onset. In New Jersey, about 72,000 adolescents aged 12 to 17 had at least one MDE within the year prior to being surveyed. The percentage increased over the last several years from 7.7% to 10.2%. So our prescription drug issue, which I know you focus a lot on in this with your municipal alliance, is it's not unique to New Jersey, but it's pretty staggering here. It's 63 painkiller prescriptions for every 100 New Jerseyans. So that's, at the root, and I bring this up because it's at the root of the sort of highway to heroin problem that we're facing in New Jersey right now. But that means, these are prescribed for every 63 person out of 100 are being prescribed painkillers. So again, as a community who's looking for ways that they can intervene and really make a difference, we have to start supporting legislation in our state that reduces the number of painkillers. We recently did in New Jersey pass, we're leaders in the nation passing legislation that reduces the number of doctors of opioid painkillers that doctors can prescribe at one time. I think our legislation is 5, which is the most strict in the country at this point. But it took a lot of work and a lot of advocacy, and that's just one example of how your voice can make a difference and how that difference can impact the epidemic of the heroin epidemic that we're facing. So right now, in 2013, more people in New Jersey died from drug overdoses, including prescription painkillers, than they did in car accidents. So we've now surpassed that car accident number. But this slide is one that's very, very important for you to pay attention to. I'm assuming that how many of you have children in the room? Oh, and how many of you have children between the ages of 12 and say 22 or 23? So this is really an important slide because if you accept the idea that prescription drugs are a connector, or at least are part of the problem that we're seeing, with the epidemic, then you have to understand that 54% of the time our kids are having access to the prescription drug through friends, families, or another relative. Meaning, they're left over in your medicine cabinet, or they're using somebody else's prescription that's not prescribed to them. And I feel like it's a really important point of education for parents in particular, that if your child is using a prescription that wasn't intended for them, that's how we define misuse of prescription drugs. And there's a direct correlation between the perceived risk of something and how often a young person might feel safe to use that drug. So what I mean by that is that as a parent, I don't feel as though it's very risky to share if my son wakes up with a migraine and I want to give him one of my painkillers or cut it in half and think I'm doing him a favor. That is oftentimes the entryway for our kids. That is usually how they get access. So it's in purses, in medicine cabinets, it's friends and relatives, the overwhelming majority. So we have to be careful about getting rid of unused medication. Because really 1 in 5 parents have indicated that they've given a teen a prescription that was not prescribed for them. And I don't think that that's done because you want to see your child have an entryway into drug use or misusing pain medication. I think it's done because you think you're doing the right thing for your child, and you need to learn and look into this a little further and understand what that can lead to. So this is not a New Jersey statistic, but this is a national statistic. 249 million prescriptions for opioids were written in 2013, enough for every adult in America to have 1 bottle of pills. So if you don't think there's a real connection between the prescription drug, the overprescribing of prescription drugs and heroin, I'm hoping that some of these statistics are starting to change your mind a little bit, and I also hope we have time to kind of talk about that, why that is. What happens when they're so addictive, and when a young person starts to take an opioid, they get addicted to it very quickly, and then if they can't access the pills anymore, it's that quick, unfortunately, especially where we're located geographically, it's easily accessible. I think sometimes they call Route 23 the highway to heroin. I know they call Route 15. There's a couple of arteries in New Jersey that they refer to as the highway to heroin because the access to Patterson and Newark is so close, and then the point of entry into the United States, in large part, is Port Newark, Elizabeth and Newark. So we have a lot of heroin that comes in through those ports. It's pure. It's the purest in the country. It's cheap, and it's really accessible. So when you can no longer get your hands on a Vicodin or a Percocet or Oxycontin because they're $35 to $65 on the street, you can get a $5 mat of heroin and 20 minutes down the street. So 80% of the heroin users start with prescription painkillers. If I haven't made that point clear enough, I hope I just did. So the opioid problem in New Jersey is, I think we were ranked, I have experts at the table, they can fact check me on the spot, but I believe we were ranked 6th in the nation as far as where we stand with this epidemic, which is pretty scary. So this says 4th. It's even worse than I thought. This says 4th in the nation. And it's ages 12 and older. So that's alarming to me. I've been in the field for 25 years. So, and you can see that our admission rate is also really high, and from that rate, 336 were for heroin and 111 for non-heroin opioids or synthetics. So the total in 2015 treatment admissions, and let me say that these admissions are admissions that are captured by the state of New Jersey. So these are admission numbers too that are probably lower than the actual admission because they're only capturing individuals that are going into state-funded facilities. So oftentimes if you have private insurance and you can send your child out of state, they may not be captured in these numbers. So that's 69,477 people accessed treatment in New Jersey last year, in 2015, sorry. Heroin was the primary drug for 40% of them, and other opioids, 7%. So 47% of our treatment admissions were related to heroin or other opioids in 2015. As I was saying before, this slide sort of depicts the traffic routes, how heroin comes into the United States, and this big dark area over here is a hub, and that's Port Newark and Elizabeth. So that's how close it is to us. And that's why it's the purest as well. So just a few more facts. The number of heroin deaths has increased for the 4th straight year in a row. Heroin is responsible for the majority of those overdose deaths. And, currently in New Jersey, they outnumber death by homicide, firearm, motor vehicle, car crashes, or suicide. So for us, every 6.7 hours, someone died from a drug-related death in New Jersey. And every 11.2 hours, someone died of a heroin-related death. This is in 2014. So I think the earlier slide, kind of gave you the national picture, and I just wanted to bring it home for you to show you that, we are unfortunately on par or, sort of at the top of the rung across the nation as far as how we're dealing with what we're experiencing in New Jersey. Now, I know I said that I wanted to first shock you a little bit. I don't know if these numbers shock you. I don't know. I'm still learning Passaic County. I don't know how devastating your community may be with this epidemic, but I know you're not immune. I can tell you that. I'm sure you can tell me even better than I can tell you. As parents in particular, or young people who are in the room, I want you to understand that back in the day, when I used to go into a health class and teach about the underage drinking or the progression of addiction, and it would start with oftentimes just that sort of risk-seeking behavior. It could be tobacco or alcohol that would initiate the introduction to that behavior, and it would move along a continuum, and oftentimes it could take till somebody's 35 years old before all the social issues that can impact you start to take place, your marriage or your job, you drop out of school. Usually you have all that time from middle school till college or post-college before a real serious intervention is taking place. But now statistics are showing that timeline is shrunk. By the time our kids start to experiment with some of these drugs, by the time they're in high school, they're already experimenting with heroin or prescription drug abuse. We don't have as much time as parents. We don't have as much time as community members to react. So what I really want you to think about tonight is how to be proactive with your kids, how to get comfortable, and you're going to hear from both Joel and Denise. How do you get comfortable talking about this? How do you get a little pushy about talking about this? You have to learn how to balance building that trust and being a parent that just says, I need to know the signs, I need to know what's going on in your life, and I need to react. I can't hesitate and wait and think, oh, maybe it's a phase. We just don't have the time anymore. But I know that for parents who do intervene and who are proactive and who stay at it, that they have a lot more success in building an open dialogue and understanding more and more what's going on in their kids' life. And I think, that is the greatest thing that you can do, because it's a lot easier to prevent something before it starts than it is to turn something around after it starts. What I wanted to just end on my slide on is, there are multiple components to addressing this issue. And we can have, hopefully, very strong and active prevention programming that can really do a lot to minimize the risk for the kids in your community. We're getting better at providing treatment right here in New Jersey, and that's a work in progress. Oftentimes, sometimes, as little as a year ago, people could wait 7-8 weeks before they could get access to a treatment center, and I believe that we've made a lot of progress in trying to open up the treatment avenues. But what we really need to do is work on the recovery, because all of our kids, all of our family members who struggle with addiction come back home. They come back to this community. And what kind of community are they coming back to? Are they going to come back to a place where they're supported, where there are supports locally for them to access, where they are given a chance to regain the things that they left behind before they went into treatment? Because if they're not, it's just going to be a revolving door. So that's what I really am hoping we can work on over the next year as my organization becomes more and more involved out here and throughout Passaic County. We need to build recovery-prepared communities that are supportive and understand that addiction is a chronic disease, and the treatment is just the first part. It's the recovery that's lifelong. And I guess on that note, I'm going to ask Joel to come up and speak a little bit about his experience.
Good evening, everyone. Thanks, Pam. I'm going to walk around a little bit, I think. So, my name is Joel Pomales. I'm a person in long-term recovery from a substance use disorder. Substance use disorder is the clinical term for drug addiction. I've been in recovery for about 5.5 years, since July of 2011. Being in recovery for means abstaining from the use of alcohol and all other drugs, while also rebuilding my life. Yes, my mom claps even louder. Abstaining from the use of alcohol and other drugs while also rebuilding my life, having to learn how to replace old, negative, unhealthy ways of thinking and living with positive, healthy new ones. And I've been doing that for the past 5.5 years. In this process, my process of recovery, I had to learn everything all over again. I had to learn how to be a son and a brother and an uncle and a nephew and a grandson and a positive, productive member of society. I always tell my friends that I've been practicing adulting for the past 5.5 years, and I've done pretty well. I've done pretty well. So I guess I'm going to go through like a bit of my story, before I came into drugs and like how I got started, where it brought me, the end of my road, and what my life has been like today in recovery, what it's like today, the process has been like, and some of the stuff I'm involved with today, I guess, throughout the state and some of the organizations that I work with. So I work full-time. I work for a treatment facility next to Rutgers University called SOBA, College Recovery. It's a long-term young adult drug and alcohol treatment facility, academically focused program. I work as the director of clinical outreach and the advocacy director, so I'm kind of the liaison between the community and our organization. So I work with all different people in the healthcare field, law enforcement, anybody in the community. I also do a lot of volunteer work with a lot of different organizations. I'm on the board of directors for Prevention Links. I've been working with Pam for the past few years. I'm one of the mentors at the Recovery High School that she talked about. I've been one of the mentors for the past couple of years at the Recovery High School. It's a very awesome gift. It's great to be a part of the school. It's an amazing thing, amazing work that they're doing. We need to see more Recovery High Schools come up in the state. So I guess like a bit of my story, right? I usually start young. We always say like there's some precipitating factors to addiction, So I'm from East Brunswick, New Jersey. East Brunswick, it's a middle-class community. I went to Blue Ribbon schools. I didn't grow up in an urban area where there was gangs or drugs being sold on the corner or anything like that, I came from a decent family, and that's like the precipitating factors. I had my parents divorced when I was young, about like 5 or 6 years old, My father was mentally ill, severely mentally ill. He was manic depressive and bipolar, and like before everybody in the world was like diagnosed bipolar, It seems like everybody has bipolar today, but it's another story, I guess. My parents fought a lot, divorced when I was young. My dad turned into like an absentee dad, I didn't really see him that much, and he moved across the country when I was like 12 years old. He was in and out of mental hospitals and stuff, and it was difficult, I didn't know how kind of like damaging it was when it was happening, but, and I guess like a few years later, after my parents divorced when I was about 5, my mom remarried to your typical like construction worker, biker kind of guy that like didn't want kids and just wanted to be with my mom. I had 2 brothers. I'm the middle child, so I also have middle child syndrome. I grew up with that. It's a serious thing. It's a real thing. And so I spent like the rest of my childhood trying to impress a guy that was like unimpressible. He didn't want kids, and I couldn't be good enough for him, you know. So I dealt with some of that stuff. But otherwise, I grew up in a nice house. Once again, went to good schools, stuff like that. And you know, I didn't have any drug use in my family. I did have, or my parents. My parents didn't drink, didn't do drugs. They would drink sangria when they would go out to a restaurant once or twice a year. You know, there wasn't anything like that. But I had one set of aunt and uncles that did drugs and drank and stuff like that, and I saw that in my family, and that was the only influence I had. I kind of saw like some of my older cousins that started getting high and drinking, like smoking marijuana and stuff like that, and saw it in my family, but wasn't around it too much. But I kind of, as I grew up a little bit, I kind of looked forward to that. I kind of knew it would be part of my life, and you know, by the time I was 13, I got high for the first time. I smoked marijuana with my older brother and a couple of my cousins from that side of the family. That side. And by this time, like I said, I was dealing with some family stuff. You know, my parents fought a lot. I didn't really like being home. I started acting out really young. You know, like smoking cigarettes when I was young. I was stealing a lot. I was acting out in school, always getting in trouble. I was a class clown, stuff like that. And you know, I was hung out with knuckleheads, you know, the bad kids, and kind of, you know, they were the kids that started messing around young and started getting high at a young age, you know, so. And I think one of the big problems that we have is like a lack of education around addiction or around substance use disorder. Like, I didn't know, you know, I went through like the DARE program, which was like really ineffective, and I didn't learn a lot from. And when I thought of like what like a drug addict was, you know, I saw like movies or TV. You know, I thought of somebody that lived in an urban area. Maybe they lived under a bridge and they were like homeless, panhandling at the train station, walked around with a brown paper bag in their hand. I didn't think of like somebody like myself from a nice community and you know, where I was from and all that stuff, you know. I also didn't know that addiction was an illness or a disease. I thought it was kind of just like, you know, you make a choice, you get high, and then you get hooked on drugs, and it's a bad choice, and you know, I thought it was like a moral situation. One of the presentations I do, I talk about addiction as an illness to kind of like make a firm point. You know, we have like a long-standing thing about addiction, you know, being a moral failing, like the stigma that we have in the community and in society from the Just Say No era, like the Reagan era, of just say no, you know, making it like a moral failing. And I think in the early 2000s, we really had some like firm evidence of like brain mapping technology being developed and to be able to study the brain while it's under the influence of a particular substance. And so amongst the medical community, addiction is either a disease or an illness. For a long time, we've been attempting to like wrest our way out of it. We've been treating addiction as a criminal justice issue rather than a public health issue. It's a public health issue is what addiction is. It's important to know that, you know, all the leading health organizations, even the federal government, define addiction as either an illness or a disease. The World Health Organization, the National Institutes of Health, the National Institute of Drug Abuse, the National Council on Alcoholism and Drug Dependence, the White House Office of National Drug Control Policy, you know, the Drug Policy Branch for the federal government, SAMHSA, which is the Substance Abuse and Mental Health Services Administration, the leading behavioral health branch for the federal government, all diagnose it as either an illness or a disease. And both handbooks, depending on where you are in the world, they either use the International Classification of Diseases or the Diagnostic and Statistical Manual. All the clinicians, anybody that practices modern medicine anywhere in the world, they use one of these two handbooks, and they also diagnose it as an illness or a disease. So, and I just highlight that because we're waiting for like a large shift in public perception to come around so we can start treating addiction as an illness rather than treating it as a criminal justice issue. Once we can get the shift in public perception, once we have enough voices around it, we can get the attention of the people who make the decisions and set policies and put funding in place, and they're able to get treatment for people and have like a huge shift in our culture, in our society, and how we treat this. Just as like, you know, when we had the LGBT movement and the AIDS movement, or just when like cancer kind of came out and they didn't have enough research or treatments for it, there was a huge stigma, and it's real taboo, and it's very scary. It's kind of like what we're going through with addiction right now. So, say all that to say, you know, the first time that I smoked weed, I didn't know that I had an illness. I didn't know that I had like a chemical imbalance that caused me to react way differently than my cousin and my older brother. So like, you know, my endorphins and the dopamine in my brain that was like, you know, the same joint that I smoked, we smoked it together, it totally affected me differently. I fell in love with it immediately the first time I smoked, and they didn't, you know, it's within a very short period of time after smoking for the first time. It's all I thought about, it's all I wanted to do. It was very confusing. You know, I'd say within a few months, by 2 or 3 months after I got high for the first time, I was smoking every day. It's all I thought about. It completely like took over my life. And I didn't know why. It was very confusing. Addiction is a very confusing thing. Like, I was a kid growing up saying that I would never smoke weed, and then like, you know, the situation came up, and you know, I was smoking and able to justify it and kind of rationalize it, and like the natural progression of addiction just like took a hold of my life, and it was just a continuous lie for the next several years about like telling myself I wasn't going to do something and then doing it anyway, and not being able to figure out why I was so okay with it, why I was so okay with watching my life fall apart around me, why I was so okay with using substances that could kill me, or that you know, that I could get arrested for and get locked up for a bunch of years. I didn't know why I was so okay with doing it. It's very confusing to know better, but to not be able to stop or say no or just walk away. So, you know, smoke weed for the first time, it was, you know, I would never drink alcohol. You know, a little while later, I started drinking alcohol, you know, and then next year it was, okay, I would never take pills, you know, I would never take a pill, I'd never do that, I'm not a drug addict. And then, you know, I started taking pills. And then like next year it was, okay, so I would never snort anything. You know, I would never snort anything, that's crazy. You know, and then I started snorting stuff. And like once again, just like not wanting to, knowing better, knowing where it could take me, and just doing it anyway. Being uneducated about addiction, not knowing that I had illness, you know. So, you know, I went through a lot, and I could like talk forever, so I don't want to do that. You know, it was very confusing. Like, it was fun for like a little while. I don't want to say it was fun, but like my life didn't fall apart immediately. You know, maybe like 2 years later, by the time I was 15, like trouble really started to happen in my life. On top of, you know, like when I was using the first couple of years, you know, school became less important. Pop Warner football went off the table. Extracurricular activities weren't important anymore. Wasn't spending a lot of time at home to begin with because there's a lot of fighting in the household. I didn't think a lot about my education, my future, you know, what college was I going to go to. You know, like the substance, like that's all I thought about was that feeling. Like it made me feel better than I felt normally, so I always wanted to pursue it, and it made it very easy to not think about anything else besides that. So, by the time I was 15, I got arrested a couple times. I went to my first treatment facility, my first inpatient treatment program when I was 15. Like one of the huge problems that we have, my insurance only covered me for about 8 days out of a 28-day treatment program. And they told me to go home and go to 12-step meetings, and, you know, I stayed, you know, abstinent for about 30 days, and I started getting high again. You know, I went through a lot of, like, really difficult things over, like, I didn't come into recovery for another 10 years after that first treatment stay. After I came home from treatment, I started getting high a month later, and my parents kind of got like fed up with my stuff. First, I dropped out of school. As soon as I turned 16, my first week in school, I dropped out. I had a very long battle with Mom. Ultimately, you know, I got her to sign on the dotted line and let me drop out of school. I was like a terror. My parents could not deal with me. I was very difficult. So I dropped out of school. A few weeks after that, my parents gave me the option. They said, you can either quit living the way that you're living, or you can leave the house. You know, we don't want you here anymore. And I mean, I wasn't making the best decisions for myself at the age of 16, But I did not want to stop living the way that I was living that much, so I decided to leave, you know. So, 16 years old, hopelessly addicted to substances, high school dropout, and homeless. You know, my parents asked me to leave the house. And, you know, from East Brunswick, the upper middle class community in the Blue Ribbon schools, you know, homeless. I never lived on the streets really, but I've lived out of my car before, and I, you know, couch surfed to a lot of different friends' houses and been in a lot of situations I shouldn't have been in, you know. I didn't go home like a few months later. I didn't go home for close to 10 years after that, you know, or to live. And, you know, I went through a lot of different situations. I got mixed up with selling drugs to support my habit. You know, from the age of 16 on, it was kind of like me versus the world, you know, like my parents asked me to leave the house. I always had like this big thing about, oh, my parents kicked me out, you know, forget them, they don't want nothing to do with me. But the truth was like my parents, you know, they said, we can help you, you can get better, we can, you know, we'll offer you help, but if you don't want it, like you can leave. They didn't kick me out, like I made the decision to leave home. I had a home if I wanted to go back to it. But, you know, I went through all sorts of different things, criminal justice stuff. You know, I've been arrested a lot of times. I've been arrested 11 times, 3 times as a minor, 8 times as an adult. I'm a multiple convicted felon. I've never been arrested for anything besides possession of a substance, possession with the intent to distribute it from supporting my habit, and or for DUI, driving under the influence. I've never been arrested for any violent crimes, no assault, no battery, no theft, no burglary, no breaking and entering, nothing like that. You know, and I can assure you, I'm very far from a criminal. I'm not a criminal. I'm a good guy. I was a good kid. I just was mixed up. You know, I didn't. So, you know, I say that because like it's just one of the huge problems that we have. Once again, treating addiction as a criminal justice issue. When I had a public health issue, I was misdiagnosed and underdiagnosed, and I didn't receive the treatment that I needed. All the times that I got arrested, I was never offered any type of help, and I just went to the county jail. You know, so I came into recovery, like I said, about 25, 26 years old. And, you know, for one of my last arrests, I had to go to a treatment program. I was going to an outpatient treatment program, going to treatment 3 hours a day for 3 days a week, like Monday, Wednesday, and Thursday, going to group therapy with other people. And I was trying to clean up. I was really trying. You know, for several years, I was really trying to stop living the way I was living. Every day, every night, I was promising myself that tomorrow's going to be different. I'm not going to live like this anymore. I don't have to do this. And, you know, tomorrow came. It was never any different. And I couldn't change. And I couldn't stop. And once again, very confusing, very difficult. You know, and I had went through the, you know, prescription pain medication to heroin pipeline that everybody is dealing with. You know, even though I knew better, even though I lost a bunch of friends to it, even though I didn't want to do it, it's just what people were doing, and it's just, you know, what happened. You know, I just watched it unfold and couldn't stop. You know, so I was going to this outpatient treatment program, and I was not able to fully stop using. I was getting high just like a couple days a week, you know, and my counselor told my probation officer that I failed a couple drug tests. And I always say this story because it's very important. You know, like my probation officer told me that I could either go to an inpatient treatment program or I could go to prison for 5 years. You know, so it was a very easy decision for me to make in the moment. Like, what do I want to do? But I say that only because, like, when I tell people how I came into recovery, I say I got the nudge from the judge. You know what I mean? People think you have to hit rock bottom. People have to go through it on their own, and they have to, you know, all this different stuff. And if we say coerced, I was coerced into treatment, you know, by the criminal justice system. Although I did take advantage of the opportunity when I went, you know, I didn't just wake up in the morning and say, all right, that's it, you know, it's time to go to treatment today, I'm going to change my life. You know, it didn't happen like that. And there's studies out there that show that people that go into a treatment program voluntarily compared to people who are forced into treatment, you know, their success rates at recovery are exactly the same. You know, so it's important to know that. So I went to treatment this last time, and I learned about addiction as a disease or an illness. And I didn't know that I had an illness. I just thought that I was a bad kid. I was dealt a crappy hand in life, and this is the way that things are going to be forever. I learned that I had an illness, and it helped a lot with self-esteem and, my self-worth and self-respect and all that stuff. I also learned about recovery, what it was going to take for me to sustain my recovery when I came home from treatment. And, I was really dedicated. I was really scared. I didn't know what my life was going to be like when I went home. But I knew I didn't want to feel the way that I was feeling. I didn't want to live that way anymore. I didn't want to feel that way anymore. So I was willing to do whatever it took. I give like a quick snapshot. When I came home from treatment, I was in like really bad shape. I was 25. I was just about to turn 26 in a couple weeks. I had zero education. The last grade I had ever passed was 8th grade. So I had 8th grade credits at 26 years old. I failed 9th grade twice really bad, and I dropped out of school as soon as I could. So I never went through high school, never went through that personal and social development period, never learned algebra, and didn't really write a lot of book reports or anything like that. I maybe worked about 6 to 9 months in my entire life. I had never worked before. I never really needed to. I pushed carts at the supermarket, and I pumped gas for a little while. So I came home, I moved into a recovery house. I moved to an Oxford house in my town, in East Brunswick, where I was from. And the guys there said to put together, we'll help you get a job, just put together a resume, and we'll send it out. And I had no idea what a resume was, let alone did I have anything to put on it. No education, no work history. I didn't have good hygiene. I maybe had like 2 pairs of clothes that were dirty. They had cigarette burn holes in them. I had really, really bad depression. I wasn't diagnosed with depression, but my self-esteem, self-worth, I had a huge amount of self-loathing. I hated who I had become. I hated my life. I could barely take my eyes off the ground. I couldn't look at you. I wasn't able to look people in the eye. I was so far removed from society for such a long period of time that I had no idea about anything going on in the world. I couldn't talk to you about politics or the economy or what happened, in the community the day before. I couldn't talk to you about any of that stuff. I could barely put words into a sentence. But I was really dedicated, and I, got connected with these guys in the recovery house that kind of taught me how to change my life. They showed me what I needed to do, to become a positive person and be a productive member of society. So, I just tried really hard. One more time. Okay. Recovery. Okay, we're getting there. All right. Yeah, so recovery. One of the first things I did in recovery was learn how to develop healthy relationships with people, positive, healthy relationships. I surrounded myself with knuckleheads for so many years, and I couldn't figure out why I wasn't anything but a knucklehead. So I got with positive people who were doing the right thing, that were working and going to school, and building families, and building careers, and all that stuff. Learned how to move away from the negative people that I had in my life for so many years. It was a difficult process, but I slowly started to learn how to just have a relationship with somebody, how to interact with somebody in a positive way. I was able to get a job. I say the first job I tried to get a job at the supermarket pushing carts, and I met with the manager, and he said, we're going to hire you in 2 days, and then he called me in 2 days, but he said, we can't give you the job because your background check came back bad. And I told him, I'm working in the parking lot with, pushing carts. I'm not even working in the store with customers or cash or anything like that. He said, sorry, it's policy, So I was very fearful about what my life in recovery was going to look like. But, luckily somebody at the house got me a job. I learned about responsibility. I learned about accountability. I didn't know anything about a 9-to-5 job. I didn't know anything about opening a bank account and paying bills. But I was able to start doing that stuff, I was showing up to probation. I wasn't using anymore for the first time in so many years, so I started to feel a lot better about myself. I started to show up to the family parties and be involved in my mom's life and my brother's lives. I was a negative. I was a detriment to the family and the community for many years, and I started to turn that around. So I was working, and I was paying my fines and paying my bills, and really starting to live a little bit, starting to feel a little bit better. And so after a little while, like I knew that I took for so long from everybody that I came in contact with and all the communities that I lived in. So I started to give back. I started to give back. I started volunteering my time, like anywhere that I could. I was donating blood at the blood drive. I was volunteering at the food pantry and the clothing drive in the community. Just learning how to give back and just make a difference. Like I just felt like it's something that I needed to do, and I did that a lot. I've done a lot of volunteer work. I'm still involved in a lot of volunteer work, and so from one of my, I guess I usually talk about education, career, and family. So through this volunteer work, I started to come in contact with a lot of people that I didn't have, that I normally wouldn't meet. I was stuck in dead-end construction jobs for a couple of years. I couldn't get a decent job because of my background, and eventually I was volunteering with this lady that was the director for the youth advocate programs in Middlesex County. And she fell in love with me. She saw the person that recovery had turned me into. I was learning how to do the next right thing. I was learning how to be a good person. And I was extremely focused on just always doing the right thing, because I never did the right thing before. So she saw me. She's like, "Oh, you need to come run this program for us. You'd be great." So she gave me my first adult job. I was the supervisor for the juvenile electronic monitoring program in Middlesex County, the house arrest or ankle bracelet program. And I didn't have the supervisor experience, I didn't have the bachelor's degree, and I had to go through the interview with the regional director. It's like, "Oh, we're taking a big risk on you, we need to make sure you do a good job," and this and that. And I did a good job. I came in, I totally revamped the program. It was the best thing that ever happened to it. I used to work every day in the family courthouse with the prosecutor and public defender that were my prosecutor and public defender when I was the defendant, when I was a juvenile. And luckily they did not remember me. So, after working there for a little while, we lost the grant to another nonprofit organization that took over the program over. But I remember when we were losing that grant, 2 prosecutors and 2 family judges in Middlesex County called a meeting with the county, and they were very upset that we were losing the grant. They said that was the best thing that ever happened to the program. There's no way we could lose this grant. It's never run as good as it did. And I remember them arguing with county officials doing this, and they didn't know that I'm the young guy in recovery that's trying to change his life and do the right thing and all this stuff. They just knew I was just somebody that was doing a good job. And I say that because I did all this crazy stuff, and I was afforded the opportunity to go to a detox and a treatment program and had a little bit of recovery support when I came home. And I was able to completely change my life and make just as much of a difference and do just as good of a job, if not better, than anybody else when I had a little bit of help. My career now, I have a really good job and I make good money, and it's just important to know that. I guess real quick for education, I'm back in school after a couple of years in recovery. I learned that I was, able to go back to school. I learned how to apply myself and do better. And I guess briefly, not going through the whole story, I'm pursuing a PhD in industrial organizational psychology. I'm in the Honor Society. I didn't even know what it was, the Phi Theta Kappa Honor Society, top 1% of the school. It was very difficult, like I said, 8th grade credits. I hadn't read a book in 10 years when I came to recovery. Very fearful. I had no idea what an internal citation was. I didn't know. I'd never taken algebra before, so I had to learn all this stuff. So my academic career is very bright. I do a lot of different, the volunteer work I do a lot of different advocacy. I'm involved in a lot of criminal justice reform and drug policy reform. I work with all sorts of legislators and senators and politicians to help draft legislation on the state level and on the national level. I'm a director for a program now that, I train law enforcement on how to deal with addicts in the community and help navigate them into the treatment system. I'm working with 6 different counties. I have 6 different county prosecutors, numbers in my phone I can call whenever they call me all the time for help with programs that they're working on. But most importantly, the family piece. I have myself back. I don't wake up sick anymore. I don't do any of the stuff that I used to do anymore. I don't break the law. I'm happy today. I could look, I could stand in a room full of people and look at them and talk about my story and like be happy about the person that I am today and the life that I live. I didn't think I ever would be able to. My mom is very happy. I have a younger brother that's in recovery now. He went through the program that I worked for. He followed my footsteps to the T. He's 2 years younger than me. We went through a lot of the same stuff. He just celebrated 1 year clean and sober on Thanksgiving. He's coming up on 16 months in recovery now. Graduated the program I work for. We show up for Christmas and Thanksgiving and birthday parties, and my mom, she cries tears of joy today. My mom cried so many tears coming to the county jail, coming to the hospital bed. My mom's really happy today. So I was able to heal. I was able to start healing my family, and I was able to start healing the community. I do a lot of community work. My mom's involved in the community now. She used to not want to show up at anything because, her kids are drug addicts, So I've been able to completely change my life. Recovery changed my life. It's very possible. It's a real thing. Addiction is a preventable, treatable, chronic illness, just like any other preventable, treatable, chronic illness that people recover from. I've been in recovery for 5.5 years, and it is possible. It's important to know that help is available. It's important to know that using anything is bad. I didn't know that smoking some weed or drinking a little alcohol with my friends was going to lead me down the road that it did, but it did. So I've loved this Municipal Alliance campaign that I've worked on a few. Parents Who Host Lose the Most. It's not cool to have kids drinking in the basement and stuff like that. All right. Thank you guys.
I'm going to try to lend a face to the family side of this. Joe ended with Mom, and I started getting a lump in my throat, so I was hoping we would talk for another minute just to kind of collect myself. I come out and talk when people ask me really just to lend a face to what's happening in our communities and nationally, and what addiction in the family might look like. And so I hope in sharing my story today, our family story, maybe I can plant a seed of hope for somebody in the room, or maybe plant some seeds of education, or maybe tell you what addiction really looks like for our young kids and our families. So my family really mirrors millions of others across the nation. We had a 17-year-old son, honor roll, athlete, 3 baseball teams, straight A's, some monies for college, a wonderful son, a wonderful brother, a comedian, just a wonderful person to be around. Heading off into the summer before his freshman year, his rite of passage to have a good time and party and do lots of good things, but also heading off to college. If anybody's Italian in the room, it's kind of hard to say goodbye to Mom and Dad. We kind of hover, and today we still watch TV as a family. So it was really difficult to say goodbye, and difficult to say goodbye to a girlfriend of 3 years. And I didn't know this at the time, but hearing the story now. So off to college he went, and we really didn't know there was a problem. Nobody ever told our family what the first day of addiction looked like. All I knew what addiction looked like, and even in our presentations today, when we talk about prevention in the schools, it's hygiene, bad friends, bad grades, dilated pupils. We don't talk about the first day, and that first day there's not a problem in the world, and they're happier than they've ever been. I recently talked to a mom who lost her child, and she said, "I just don't understand." It was the first time Johnny ever sat at the table with us in the last 2 years. He liked being with us. He was playing with the dog, wrestling with the dog, having fun. I knew those were red flags because I had been down that path, and I didn't share that with her. So while I'm going to share my story, I always like to mention that first day. It looks really different than what we see and what we're told in the prevention efforts. So I just do want to plant that seed. Yours. Better? So that's it on prevention. I'm going to leave my card here, and Pam knows where to find both Joel and I. But I just want to get to my story too, our story. So I often refer to it as the same chorus, different verse, because it truly does mirror millions of families across the nation. And so I'll talk about that chorus. What does that chorus look like? It's finding out that your child is struggling with substance use. We were fortunate that our son confided in us from college that he was struggling. And as parents, we thought, okay, you'll come home, we'll fix this, we'll get treatment, and that's what we did. So, I mean, we really thought his honesty and our willingness to help was going to be the end of all of it. But really what that chorus looked like was being denied treatment for 2 years, denied all kinds of help for our son, really denied everything, while we paid a $1,600 premium to our insurance company. So our son continued to spiral. What that course also looks like is the family trying to understand what's happening in their lives, and what that course looks like is being shamed and blamed and judged and stigmatized no matter where you go. And what it also looks like is maybe 40 families sitting in a support group, and that person at the other side of the table saying to you, there's nothing you can do. Let your son hit rock bottom, disengage, and let go. And I'm like, he's 18. We have another son with a medical disease, and my husband's here, and we just didn't work for us. It just didn't click. And to us, it was unacceptable. This was my child. I'm not going to give up hope. And so what we did was beg for help. Dropped our insurance, tried for other, literally begged for help. I can remember one day writing 122 emails and having one person answer me. And that's the Partnership for Drug-Free Kids, and where I continued to volunteer with them for the next 5 or 6 years, because they were the only ones that listened to our family and didn't judge us and felt that we shouldn't give up hope on our kids. Our story continues for 4 years of being denied treatment, but we did have a miracle, which he did get treatment in California, but then that course continues of just a broken system of regardless of whether it's denied treatment. I can remember my son calling and saying, Mom, I struggled today. I did take a pill after 8 months. And he's like, I'm going to talk to my sober manager. And I said, you know what, I'm proud of you for calling us. We were proud of him. It could have looked a lot different. So here he went to somebody asking for help and being kicked out for the very thing he was asking help for. And ended up living on the streets of Los Angeles for 3 months. Called us every day because he was worried about us. And it's just unfortunate, it's a broken system. Again, I could go on like probably Joel and tell my story and for hours and hours, but for me today my journey's changed, and I like to talk about the good stuff. So my son, 4 years later, is now 3 years in recovery. And I think a lot of it is the hard work he did, but I also think that, and I know because he tells us this, that we didn't give up hope on him, and that we answered that phone, and we knew we were always there, and we weren't going to let him hit bottom. In fact, we were going to help lift him up, and we weren't going to disengage. We were going to do everything we could to engage. So I started volunteering my time with the partnership, and that our story always upset them. You know, the fact that we were told to do this as parents. And we came up with this program, and we all learned craft and online, and we worked with some physicians. And 3 or 4 years ago, we started a parent coaching program. At the partnership, they have a toll-free hotline, so parents can call there and get free help. And you know, education, what does treatment look like? Is it a recurring disease? Where can I get detox and so forth? But what's really special about the program, about this organization, is that they created this program to give families an option that we can, you know, help them and spread some hope around. And today there's 90 of us coaches. from across the country. Every one of us has either struggled with the family disease. Many of the parent coaches have lost their children. And the message that we try to say is, we believe in you, and we teach them tools and strategies to communicate with them instead of argue with them, to get the mother and father on the same page and that united front to help their child. And the outcomes could look really different. You know, I ended one case, let's say 2 months ago, where the family was fighting and arguing and the parents weren't on the same page, and by the end of the call, and everything is free from, you know, for these parents, by the end of the call, that family was a little bit healthier and the child was willing to go to treatment, that child that was in denial. But just as beautiful for us is that case where, you know, the mom calls and she hasn't seen her child for 14 months and she knows he's living on the streets and she misses him. And the way that case ends is that they're having lunch every week, excuse me. And to me, that's just as good as an outcome. So that's what we do. In addition to that, which is really a wonderful thing at the partnership, is they include us parents in their resources. We're a face for them. We keep them honest. And the resources are good. They're toolkits. What does addiction look like? What I spoke to you in the beginning. What if they are struggling? How do we intervene early? How do we communicate with them? So our journey is different today. It's one of planting seeds of hope for sure, and sending a message, whether it be at the state level or national level, federal level. I don't like to talk, but I know it's my responsibility. I don't mind talking to you guys, but I mean like in that big kind of thing. But I know it's my responsibility to be that voice for families. And families are really causing a lot of policy change and good change today. We have a voice today. And if anybody in the room is struggling, we all know somebody or a friend. I guess my message is that, you know, to not give up hope and to hang in there and do recover. And my son's part of that proof, and so is Joel. So thank you.
I'm not sure if anyone wants an opportunity to ask Joel, can you turn that off? Is that good? Okay. Ask questions or have comments? Yep.
I had a question for Joel. Joel, you were speaking a lot about you know, how you started with marijuana and then progressed on. When you were in the early stages of that, I'm just curious if you could tell the audience, you know, were your parents aware? How did you hide it? What are some of the things that you did to kind of, you know, that maybe the parents in the audience can look at and watch out for?
Yeah. It was tough. I mean, for me, it was like...
Mike.
Yeah? Do I need a mic?
Right, the one in front of you.
Yeah? It's okay. Try. It's nice and easy. Okay. Everybody's situation is different, you know what I mean? Like my family dynamic was a lot different. I already had some stuff going on at home that didn't really make it very easily identifiable for my parents. You know, like my normal day was like come home from school and then go out real late at night, like come home on curfew because there's a lot of fighting and I didn't like being home. So, but they did know after like a little while. Then you know they sent me to my first treatment program when I was 15, so they caught on within the first year. Definitely did not approve, you know, but I didn't, you know, I was already used to getting grounded, already used to having a lot of privileges taken away, and I loved just being an adolescent and doing the exact opposite of what I was told. You know, you told me to do one thing, I just did another. That's just the kind of kid that I was, you know. So, I mean, they did their best, but, you know, eventually my mom kind of gave up after some years, and that's just the way it went for us. But, you know, being involved, you know, like I said, some stuff started to fall by the wayside. Like if you see kids' friends change, if you see them drop extracurricular activities, if you see them drop things that should be normally important to them, you know, nobody knows your kids better than you. I always say, like, if it seems like something's up, it smells like something's up, something is up. You know, don't live in denial. Don't try and say it's okay. Don't try and say it's a phase. You know, like we need to do something about it because perfect example that, our story I just gave, what can happen from just, getting high a little bit and using it. So,
Thank you.
yeah.
Yeah. You said that you went through the DARE program when you were young and didn't really make much of an impression. What do you think would have made an impression?
It's a very common question, like what could have been done, I get it asked all the time. I wish I knew, once again, it's very individual. I feel like though, like if I would have had some of my home stuff addressed, some of my family stuff addressed, that it might have helped a little bit, like I was going to anger management classes, and I was in like the divorced parents group when I was a kid, but I just feel like if some of that stuff was addressed a little bit more, it might have helped. But I know kids that came from perfect families and grew up going to church and didn't have any problems at home and stuff like that, so I wish there was an easy answer.
I'm just going to piggyback on that a little bit if it's okay.
So I'd like to say two things. What I think it should look like and what we're seeing it should look like. Maybe those prevention classes, in addition to telling the real truth about those first days, is it should look a whole lot about health and wellness and coping mechanisms. How do our children cope? And even for us parents too, right? Letting them know not to be in fear to come and talk to us. And also as parents, maybe take some of those stressors off of them. It's a combination, to get the best grades and go to the best college and be the best at baseball, football, lacrosse. The stressors that we put on our kids, if we sit down and just reflect for a minute, I think the combination of that and just at a young age, let's talk about health and wellness and coping. So maybe that child that's, wanted to get out of their head for the day, which was mine, might have had a different coping mechanism. And when we ask him, you told us everything else. I can't even tell you how many, like TMI stuff you told us. Why didn't you come tell us that? He's like, I just thought it would go away. So we really need to educate our kids instead of instilling fear in them and just say no. So I just wanted to piggyback on that.
And I'll just add, unfortunately, I don't know about, and I've been in prevention for a long time, but where I'm learning the most is working with the kids at the Recovery High School and providing them, and this is not, I'm reading this as well, what's emerging as new science for adolescent recovery and treatment. They need to be able to be adolescents. They need to be able to bond with their peers. So what they really need is an opportunity to be able to talk about what they're experiencing related to their drug use, their treatment, or their experimentation, and also build a new set of peers who are also seeking, a drug-free lifestyle. They have to be able to have an opportunity to feel like adolescents, go to the movies, be recreational, social, but remove the drugs from that scenario. So they have to be around other kids that are seeking, either post-treatment or even before treatment, drug-free lifestyle. We need to be comfortable with the conversation. That's what they're saying to me. That's why Joel he's a mentor for our kids. And basically what they do is go out on the weekend to the movies or bowling. But when they go out with a group of people who don't add a field party to that picture. They don't add smoking pot wherever they're going to, it's drug-free and it's fun. And it's without parents and it's, with other kids.
Yeah.
It's a really important piece. Mm-hmm.
I have a question. I understand recovery is very hard, and it's one of the hardest topics, and you overcome a lot of obstacles or try and overcome. When you came to your recovery to find your first employment opportunity, it was a full-time employment. Who and where did you go to? And what programs are out there to support these people that are in recovery to find a job and start their way of life in the right place, in the right direction?
Well, like I said, I first with people in the recovery house. My first couple months, I didn't get it on my own, so I was kind of handed a job. But where we direct people to, I usually direct people to one organization in New Jersey, Reentry Corporation. It's something that's available in some areas of New Jersey, not in all areas. But in each county, something that I was introduced to after a little while was the DVR, which is the Division of Vocational Rehabilitation, which is through the Department of the workforce and labor development in each county. So they diagnose substance use disorder as a disability that they will fund for somebody to get some training. They were willing to pay for me to go back to community college, a full ride. I know people that have went to four-year universities through funding through the county because addiction is an illness identifiable by the organization. So that's available. You go meet with the counselor and they assist you, identify what do you want to go to school for, what do you want to do, pay for the training, and help get you placed in that field. So that is available in every county throughout New Jersey. Yeah.
Other questions? Great, so I hope that we continue the dialogue.
I have teenager kids, and I'm told by my teenagers smoking pot's okay. Listen, I grew up fear of my father. Irish kid, growing up in the community, drank my beer, whatever. I understand addiction. I am now involved with West Milford politics, so obviously we have a grant going to try to help. I guess my question is, what's wrong with the old school hit you kid? Or putting a fear in them that, you're gonna go do something, somebody's there to, there's some repercussion. And a lot of that has gone out the window because I've been in my own house having a conversation and they say, you get cold diapers. Cold diapers. I have a brother that's a drug addict, very successful man, hit drugs later on, not even heroin or whatever. That used to beat me as a kid. He got hooked on Adderall from a doctor. So my biggest question is around this group here, is what's wrong with the old school of grabbing the kid by the throat and, take him, lock him in a room, do what you gotta do before the police show up to your door?
It's illegal, that's the big problem.
How is that illegal? Take your kid if they're doing drugs.
It doesn't work.
Or stop
It's illegal.
it. But the fear of it, no?
The fear is also partly illegal. You have to look into that aspect there. Children do have rights. Not saying that they're not upsetting and you need to do something, but actually putting your hands.
So my daughter tonight, 15 years old, she says that everybody in West Milford smokes pot.
Well, you know that's not true.
I know.
So I'd like to know.
I said, I know, so not everybody does. I get it.
But the problem is it is illegal.
I get it. You say talk to your kids, but her main thing was, isn't that okay? That's not as bad as heroin.
So here's my comment, here's my response. Hopefully, the younger your child is in school, you can start being disciplinarian, minus the beating. The better off you're going to be. And by that I mean following through with setting, following through with the standards that you set. If you have a curfew, you make them abide by that curfew. I always tell parents when I talk, if it's in your house, then you have a right to go look at it. Like, be in their room, look through their things, don't be afraid, don't try to be their friend. I mean, I think, again, it gets to that point where you feel the way you feel, like, why can't I just grab my kid by the throat? But I think it starts a lot sooner than that. It starts a lot sooner with us being afraid to say things like, because I said so, because somewhere along the line somebody told us we're not allowed to say that anymore. No, you're not allowed to go out. No, yes, I'm going to call and make sure parents are at that house party. Like, it's about being an active parent and being consistently an active parent as young of an age as you possibly can. And 9 out of 10 times you don't get to that, I have to hold you by the throat. So that's my answer to you. But, that's the best answer I can give.
Okay, the police department is doing a very active job through the detective departments where you can come in, whether you're a parent, a kid, or whatever, in our township, and there's going to be no questions asked. Do what you got to do. It's painful. And there was a question asked on the dash, how do we pay for it? It's hard to pay for it. It's, as a community, it's hard to come up with those funds. So, as West Milford, the way I feel is we are trying to do what we have to do through the police department or whatever else, but I believe that there's got to be a little bit more creativity at home, fear factor, whatever, discipline, where, you know, you don't have to feel like you're doing something wrong. That's how I feel.
Hey, well, good. Go to the next question.
We have somebody on here.
She's got a question. I already
I think an attitude of mutual respect might work better. I was a good kid. I did get hit. I had a fear of my father. It didn't help our relationship. I would encourage a respect and dialogue. I think that would help tremendously.
Absolutely.
And I just want to say thank you for the people who were sharing their stories. And, you know, just thank you for doing your important work.
Yes, I have a question. What can the schools do? Question for the whole panel. What can the schools do to more effectively educate and prevent the first usage? Which it seems to be where, you know, you really, that's the crux, it seems like, is the first, you know, jump into use. How can the school system better educate the kids or make an impression on them? Now, I've had a couple of local youths tell me that you have to have the folks like you come and talk and really show them what it is in a way that will resonate. But other than that, I'm not really getting a lot of information from the experts as far as that goes.
Well, I can start, but there's no one single magic bullet that's going to work. So I think the schools can't function alone. They have to function in conjunction with a continuum of prevention services and messages. So, and have that be coordinated. So yes, it's a combination. Prevention is very poorly funded, unfortunately. So we can go into, a health class with a program, an evidence-based program, but if we're only going in for first grade, and then we're not seeing that student again until 8th grade, there's all that time that we miss. Unfortunately, short of that, I think the schools they try to do the best they can with the limited funding that's available. So what really has to happen is they need to participate in a coalition or a municipal alliance like this so that the services are coordinated. So if the school only has funding to deliver a first grade program, and the alliance program then is going to do 3rd and 4th grade, and then maybe another entity is going to come in and make sure that the 5th and 6th graders, that message needs to be delivered by someone like Joel. It also needs to be delivered by someone like me. And you can get the motivational speaker to come in and talk about that as well. It has to be a continuous effort throughout the course of their education. And that's really what I feel is missing in the schools. Just adequate funding and attention to provide prevention services throughout the whole continuum. So in a community like this and others, you have to work in tandem. One hand has to know what the other hand is doing, so that not everybody's delivering a program for first graders and then 5th, 6th, and 7th grade gets nothing. That's really that's the best answer that I have for you. I don't know if you guys have
I know, and I think every prevention program from every school is going to look different, right? Because there's no ordinances, there's no state mandates. What we find incredibly helpful is even that it truly does take a village. Maybe it's, in addition to our stories, it's that parent going in there with some ideas and talking to, to that SAC in that school and that nurse and just sharing with the two of them your story really helps change their perception of what addiction looks like. And then they get more passionate about their program. We've seen it in a couple of communities. So just sometimes us going in there and really, humanizing the addiction story and changing their perception gets them really involved and passionate.
Yeah. I think we, kind of with what was already said, I'm part of an organization. So I go into my school system. I'm from East Brunswick, so I go into the health classes, the 8th, 9th, and 11th grade. We have a team of people that we work with that do presentations. just share as a young person, a peer, somebody that's closer to their age. We don't come in, we're not a police officer, we're not coming in uniform, we're not a clinician coming in using terminology that I'm not familiar with, and talk about addiction, we talk about recovery, we try to make it real. And we're a small organization that does this, or resources are limited. We've gotten great feedback from the board about the effectiveness of the program. We've had a lot of people disclose. A lot of people talk about it after class the next day with their teachers and stuff. So I think that is huge, but it definitely is more than that. It's not going to be just having a young person come in that's in recovery and share their story, but it has been effective. There are other organizations that do that. I'm with Young People in Recovery that does that in East Brunswick. Steered Straight does that throughout the state. They have, a team of some young people that will come in and share. And it's been pretty effective, but, it's tough to say exactly what it's going to be.
You need a combination.
Yeah.
You need one message from Joel might really resonate for one student, but then a class on how to say no, or life skills or peer pressure, and how to build resilience skills is going to resonate for somebody else. But again, it needs to be a coordinated effort, and I think parents really have to learn the language on how to be comfortable to talk regularly. Set some rules up. The trust factor has to be there. If they tell you about
And
somebody
listen.
else, yeah.
I think as parents, we need to listen.
Without judgment.
Right.
Yeah.
Just take the time to listen, and it's pretty amazing what you'll hear. And maybe you might not know what to do with that right then and there, but when we take the time
I used
to
to have the
listen.
24-hour rule with my son. When
Yeah.
I was like, you can tell me, and I promise I'll wait 24 hours before I really respond, because he needed to go off the ledge. But I also wanted him to feel like he could say anything without me launching. So we had the 24-hour rule for a while.
That's a good one.
It is important to note too that in September, legislation was passed that changes the core curriculum surrounding substance misuse education for grades K through 12 through the state. So there's more. Yeah. Yeah. But from all this conversation, that is changing itself as well.
Do we have any additional questions? Raise a hand, please. Everybody, please thank Pam, Denise, and Joel. Thank you very much.
I forgot, I did want to say one thing before we say goodnight, and that is I am incredibly impressed with the number of people that are in this room.
Stayed.
We do this a lot. We go over, to communities all over the state of New Jersey, and it is not easy to get parents out in the evening or at any time. So clearly you're an engaged community, and I just wanted to say that. Thank you. Thank you for being here, and thank you for staying.
The reason why they all stay is because we promised there was a raffle at the end of the evening, and you're all waiting for that. It looks like I got one more question first, though. Melissa?
I have a question for Joel. You had mentioned that your mom was going to show up to some meetings or perhaps like dinners like this. How do you get people in the community to show up to events like this for the people that really need to show up?
It can be very difficult. The most successful stuff that we've seen is like bribing parents. Like in kids in high school, kids that are getting a parking space when they start senior year, or some type of extra credit in classes. It can be very tough to bring parents out. Sending flyers home, sending mailers out. We do a lot of different stuff. But stuff like that, some type of bribery is what
And
works
the coaches. The coaches are really key, because just like that fear factor that we spoke about, I could remember us having an event a couple of years ago, and I would say to my husband, oh my God, I hope we get
200 people there. And I said, you know what, we have to talk to the coaches, to this one, that one. And we had 1,600 people show up. The coaches were key. And the coaches were from around the entire county that said, you know what, you're going to play on my team, we're going to go do this tonight. And the parents followed. So you can get really creative with that.
That's a great point, Denise. Thank you. Yeah. And Joel, just so you're aware, we did bribe you with free food. Any other questions before the end of the evening? Thank you again very much. I really appreciate it. We have one more.
Thank you, everybody, for staying this long. We are going to give away, we were donated a gift certificate to the new restaurant in town, Ralph's Spice. So I am going to read off a number here, 694-035. Yeah, come on up. Thank you for driving them. Here it goes. Thank you so much for coming. Good night, everybody. Thank you.